Welcome to the Muscle Expert Podcast with Ben Pakulski, one of the world's top professional bodybuilders, an expert on human performance and mindset mastery. Ben dives deep to deliver the strategies of the top experts to upgrade your body, mind, muscle, strength, performance, biochemistry, and how to become the upgraded modern man. Join us on benpakulski.com to learn the cutting-edge techniques to take control of your body, your brain, and create your greatest life.
Hey, what's up, ladies and gents? Muscle Expert Podcast, Ben Pakulski, and today we're going to interview Dr. Gabrielle Lyon. She is a fellowship-trained nutrition and cognition physician. She's got her own center called the ASH Center for Comprehensive Medicine in Manhattan, and this lady is integrating everything when it comes to optimizing muscle. And you guys are going to want to listen to this one because if you like muscle and you like longevity, you're going to love this. We dive on everything as far as hormones, training, environment, mindset. And you know, I'm a geek around mindset. Dr. Gabrielle is awesome. She's got an incredible message. Ladies, you're going to love it. Guys, you're going to love it. Don't forget to leave us a review and share. And I look forward to all of your feedback. Have an awesome day and enjoy Dr. Gabrielle Lyon. ATP Labs has a fantastic, efficaciously dosed testosterone supplement. The 7 most clinically proven ingredients to support and maximize testosterone. Now, a lot of people think that testosterone replacements or testosterone boosters don't work, and that's not the truth. If you have the right ingredients in the right ratios, they absolutely do work. They only work for about 3 weeks. So I suggest you guys take this for 3 weeks and then try 3 weeks off. And during the 3 weeks off, you may want to try some estrogen detox. And that can be done with the estro support that ATP's got as well. So enjoy that. And guys, enjoy the podcast to your greatest life. Enjoy. I couldn't be more excited about talking to you because you're doing all the stuff that I love. Like you're talking about, you know, obviously muscles and muscle protein synthesis, but also the cognitive aspect, which is where my brain is shifting now. I love it. It's so awesome. What do you get excited about now? Tell me, I want to hear about like what you're getting you pumped up in the morning.
So it's really interesting. I'm a functional medicine practitioner. Mm-hmm. I have a practice on 61st and 5th Avenue in New York City. And it's really about optimizing muscle tissue for people. Mm-hmm. It changes the trajectory of their life, right? And if you think about it, I mean, so you come from a sporting background. Mm-hmm. There is this kind of trajectory where people, you know, really kind of like young and they have a lot of bravado and they maintain all this muscle. And then something happens, right? The whole dad bod or whatever. And then the trajectory of aging really decreases. Mm-hmm. And part of that is because they don't do the right things to maintain the muscle integrity. And with the loss of muscle integrity comes the loss of cognitive, right? It causes cognitive decline as well. You know, I did my fellowship at WashU in St. Louis. Yep. And I did obesity medicine and geriatrics and cognition. So really kind of getting people on track to age well and have a lot of longevity is amazing.
What is the cause? So from your obviously research and experience, what's causing that degradation of the muscular integrity, to use your term? Is it just lack of activity? Is it a hormonal degradation?
So it's a multifactorial kind of complex issue. The fibers that we typically lose as we age are the bulk fibers, the strength fibers, which is why you see people age, they kind of shrink. Mm-hmm. There's that natural inclination to happen, but it doesn't have to. People tend to work less hard as they age.
Sure, they're
afraid.
afraid.
Of course, you know, the hormonal shift, and then also the mind frame, right? I know that you're really interested in the mental capacity of training. Mm-hmm. The individual's mind frame and ability to tolerate hard physical labor and really having to push themselves also changes.
Do you think it's a fear thing because they're afraid of hurting themselves, or is it because they no longer have an incentive to look great?
Yeah, I think that there is that loss of intrinsic motivation that happens. And I think that the society that we live in, it's so easy to become complacent, internally complacent, right, unless you're constantly sharpening yourself. You know, iron sharpens iron, and really the to maintain the physical prowlness and to really maintain that metabolic organ, which is muscle, requires a whole different attention as you age.
I've been doing a lot of digging lately, just kind of personally geeking out about androgens' effect on neurotransmitters. And my theory, obviously, is everyone ages, their mitochondria start to downregulate and lose function, and then thereby hormones aren't produced as well. And then it goes into neurotransmitters, this massive cascade. I think it has to be hormones, right? And if we just augment hormones, it seems as though our motivation will be increased because dopamine won't drop. And then maybe we'll be more inspired to train and just be vigorous and rigorous at life.
Yeah, that's absolutely right. We know that testosterone and estrogens are actually neuroprotective.
Yeah.
So having hormonal balance is absolutely neuroprotective. It's really this complex symphony that is extraordinary. Aging does not have to happen the way that we experience it, right? Like crazy.
Yeah.
It's crazy.
Yeah. So what's getting you excited about, how are you helping people most? Because I know you're doing a ton with functional medicine, just helping people in your day-to-day practice. What are you seeing that's, moving the needle the most for people, and what are you excited about as far as your direction?
So people come to me for very specific reasons. I see really two groups of people. So I see some of the elite military, so SEALs, special operations, very specific kind of group. And they have muscle mass, and really we're looking for metals and inflammation and keeping their nervous system together. And then the other part of my practice is people with metabolic impairment. So you've got women that have yo-yo dieted their whole life. I have men with low testosterone that are now kind of transitioning to a higher estrogen state. And really, when people come to me, it's all about muscle-centric medicine. So I'm a specialist.
I love that term. I want you to tell me all about that term.
Yeah.
Because that, to me, I think you're on this path to literally revolutionize the paradigm of the fitness industry. And I'm trying to do the same thing. We could talk about that later. But you have such an awesome focus. And I want you to tell me all about it, because everyone deserves to hear about this.
Yeah, absolutely. So muscle is, we always thought about muscle in terms of locomotion and strength and kind of the architecture of the body, but it's actually the infrastructure.
So much more.
Right? It is responsible for metabolic regulation. It's responsible for glucose metabolism. It's responsible for lipid oxidation. It's anti-inflammatory. It's responsible for growth. You were talking about hormones and all of these things. So we focus as a society on being over fat, but we're actually under-muscled, right? Muscle is actually an organ. It's an endocrine organ. It secretes all kinds of things.
Right.
So, you have a cardiologist who's a specialist for the heart, a pulmonologist for the lungs, but we have nobody talking about this muscle, the organ of longevity. And as you age, you have to eat and train in a very specific way to keep that tissue healthy. You no longer can train the way that you did in your 20s and 30s. It doesn't work. Right?
I'm loving the message more and more. I love it. You're preaching to the choir.
It's crazy. It's crazy. So, I do come from a community of functional medicine. And then within that community, there is also a lot of vegetarianism and a lot of veganism.
Sure.
And what I see, right, and I'm fellowship trained. So I trained at WashU in St. Louis. I did a clinical research, and I did patient care. So what we found was the people that really struggled later on in life were vegans and really strict vegetarians, because we know that bone and all of these things are made of proteins. So that is a long-winded way of saying what gets me excited. And it's really about bringing the truth, kind of eliminating the bro science and the opinion and the emotion, and really bringing true facts to the forefront to help these people. Because
awesome.
what you don't know can hurt you, and especially as you age.
I feel as though you're the only doctor that I've come across, or the only person that's having this conversation from a holistic perspective. Like, you're looking at it from all these angles. And that's the way we should be looking at it, right? That's the way I look at it. And I'm like, why isn't anybody else having this conversation? And I literally think you're going to be the one that's shifting the paradigm of the fitness industry, or at least being the catalyst for change, right? And making people aware of, like, hey, man, you have to take care of this. This is you could argue that which one's your most important organ, but it's such an important aspect to everything. And people are talking about, like you say, diabetes and inflammation and all these things. It's so easy to mitigate those things just by exposing yourself to a little bit of exercise.
Totally.
Yeah. So what are the first intervention strategies you're applying? Let's say we got a Navy SEAL, because that's a really interesting demographic that people are really diving into right now. So someone who's, a high-end, any type of, Army, Navy, Marine, whatever it is. What is the first kind of intervention strategy to help optimize their performance? Because they're not just normal people. They're looking to be like, cognitively sharp as a knife.
So it's really interesting. There's kind of two extremes from my experience of treating these people. They're the ones that are really into functional medicine and are doing ozone therapy and are very dialed into their macros and are really, really aware. Those guys are much easier. So their first line intervention is really about keeping their nervous system on track. And those guys are meditating. So it's really about adaptogenic herbs and then measuring their vitamin status. Are their omegas where they need to be? Where's their glutathione? What kind of nutrients are very specific to them? And then there's more of the, I don't want to say reckless, but the more rough and tumble.
Sure.
That are not so open.
It's the same thing like in my sport, right? You get the guys who are actually using their brain. You get the guys who are just working really hard, and both of them make it really far. But when you speak about longevity, there's certainly something to be said for someone taking care of themselves.
Totally. And so the first line for the guys getting ready for buds, I just had a patient who just completed buds. And then I have an active Navy SEAL right now that we're really working on doing some of the basic stuff. And that's actually just cleaning up the diet, making sure that the protein and the calories are where they need to be, and reducing inflammatory type things.
So you say cleaning up the diet. So talk about that, because what does that mean? Like, what types of things are you removing? Because I think people need to hear that stuff. As much as you and I think it's common knowledge, not everyone knows, like, hey, when we say cleaning up the diet, what are you removing to optimize the nervous function?
So it's interesting because there's a lot of question as to whether this is bro science or real science, but I can only tell you from clinical perspective that there are a lot of people with gluten sensitivities and a lot of people with dairy sensitivities. It doesn't mean that they're allergic, but it really creates a lot of brain fog because there's kind of this inflammatory cascade. And in my clinic, we measure lymphocyte reactivity. So we have one of the original researchers, or one of the, I shouldn't say original researchers, but a very prominent researcher in the NIH developed this study called the LRA. And so we utilize that when it comes to sensitivities for all kinds of foods. And eliminating gluten and dairy always seems to come up for these people. And so really kind of just pulling that back and putting in high quality protein and less of the packaged type stuff, and high quality carbohydrates like sweet potato, brown rice, quinoa, really kind of streamlining their nutrition.
Great. Yeah. So, I mean, as far as the gluten thing, it's my argument with people is it bro science or not? I don't know. But 90% of the people that I encounter have an issue with it, and it's not helping you in any way. So just removing it can only be better, can only be beneficial, right? There's nothing good about it. It's not like you're weighing good and bad. It's like either it's going to be neutral or it's going to be bad. So just take it out for most people, right? Like, not everybody. Some people can do okay with it, but it seems as though, like many lectins, anything, it's obviously a dose-dependent type thing, and if you're taking too much, it's going to affect you. Yeah,
absolutely. So really streamlining the nutrition is really important. And then, of course, basic fundamentals in terms of getting your macros right. It matters. Mm-hmm. So whether a food is not inherently a bad food, whether it's ground bison or sweet potato, the imbalance of either or, really getting, food is medicine. It's a nutritional science.
Yep.
So what you put in your body and the amounts and the macronutrient ratios completely affect your insulin and your metabolism, and really sets you up for being sharp cognitively, or it can also create kind of cognitive decline in all these inflammatory processes.
So what type of ratios are you looking at for optimizing, let's say we say a Navy SEAL, and is it, how individualized is it, or do you have like a starting baseline where you say, okay, you start here and then we'll adapt according to how your body responds?
It depends on activity level and weight, right? And lean muscle tissue. So if it's a big guy, right, I always, I am definitely, I was trained under Dr. Donald Lehman, so I always err on the side of high protein, and that's at least a gram per pound of lean tissue. right? And then we also know that you need 30 to 50 grams, especially if it's a guy, to actually maximize the muscle protein synthesis, because we don't want just a baseline stimulation of mTOR. You really want to max out the system.
How much are you considering, sorry to interrupt, how much are you considering sources of protein? So obviously,
that's huge.
Yeah, I know for you it's huge. How much are you a proponent of, avoiding pesticides and things like that? And how is that playing into their overall performance and health?
Whatever they can get in is really important. So it doesn't really matter. I mean, obviously, if it can be organic, fantastic. But if not, that's okay. And I treat a lot of other athletes. I have a race car driver, a PGA golfer. So really kind of the core fundamentals are the same for everybody. High quality protein. We know plant is totally different than animal protein. We know that these protein digestibility scores, none of that matters. It really matters about the branch chain. If you're talking about, muscle protein synthesis and optimization, you require leucine. There's no question about it. No one's eating 6 cups of quinoa, to get your equivalent of a chicken breast.
I know you're going down that road. It's, so since my exit from bodybuilding, I've retired from bodybuilding for 12 months, and I've been eating a predominantly plant-based diet, but I eat meat with every meal. But it's like I eat plants and then just a little bit of meat, a little bit relative to what I was eating in my bodybuilding career. Yeah. So in the last 3 months, I've had 10 people come out and ask me if I would coach them for vegan bodybuilding, vegetarian bodybuilding. And I was like, I'm literally thinking in my brain, like, if we were perfect with everything, could someone be successful as a body? Meaning we augment, BCAAs, we augment essential aminos. I'm very curious your opinion on that, because obviously you're an mTOR and an AMPK specialist.
I'm actually really glad you asked that question, because I think that there are individuals that have a particular phenotype that can do amazing vegan and vegetarian. I think the percentage of people that can do that well is very small, but I have seen patients be keto vegan and vegetarian and vegan and do phenomenal. It's really, and
keto,
I think that
did you say keto vegan?
Keto
I
vegan.
didn't even know
and
that was a thing.
Yeah, and the forefront, and I'm actually just starting to do this. I have a good friend, Ralph Esposito. You should definitely have him on.
Cool.
He worked under Peter D'Adamo, and what we're starting to look at is genes. So you run the 23andMe, you run Ancestry, and you put it through this system called Opus 23, and you look at the genetic capacity to handle really particular feeding, particular diets. I'm telling you, you can be vegan and vegetarian and you'll know within your genetic makeup if you can do that.
So is Opus 23 giving you the entire readout of your genetic code, or is it just specific to your nutrition?
So I'm very new to it, and I use it very specifically for body composition optimization. And I am by no means an expert in gene translation and these things yet.
I don't think anybody is yet, to be honest. I've been discussing it. I actually had Dr. Daniel Reed on, who's the guy who created Fitness Genes. And it really, there's obviously there's the people who are actually in the lab doing the research, and they're obviously experts. But as far as people in the fitness industry, I think it's so diverse, and there's so many interactions. Like, one gene is coding for one thing, and then you get something else that's completely knocking it out. There's so many interactions that I think it's just too new.
Yeah. And, and I've had other people say that as well. They think that it's very new. It's definitely, if we can figure out who, and of course, then there's the clinical experience of trial and error. You've gone more plant-based and feel amazing. I think that
just because I'm trying to lose muscle, to be honest. Like if I was not trying, sorry, that just sounds blasphemous, I know. But like I walked around at 310 pounds for
that's it?
15 years. Right. So now I'm down to 270, and I feel like I can run a marathon, right? So I just, walking around at 310 pounds for anyone is not healthy. So I'm trying to downsize a little bit. Not trying to get small, just downsize a little bit.
Yeah. There's, what is it? Something that I utilize in my clinic is I do think intermittent fasting and, fasting mimicking diet for, say, a week, 5 days, 5 to 7 days is phenomenal. I do think I take breaks on eating protein. Once, I would say probably once every 8 weeks, I go a week where I'm pretty vegan and very low calorie. And I think that I think it's important to not be so dogmatic in thinking and really be flexible, medically flexible in your mind. But there is some really good research out there. for upregulation of all kinds of things to help longevity and the body reset, hormones, everything.
So giving you my experience on that you want to hear it, but when I was, as a bodybuilder, I was so focused, like most bodybuilders, on consumption, and my energy sucked. My training started to fade sometimes. Now, like I haven't eaten yet today, once a week, I'll fast most of the day. I might have one meal. And my energy the next day, you would presume, would be depleted or down, or my strength would be down. It's actually not in any way. It's just my body's adapted and learned how to use the nutrients that I'm eating way more effectively. Now that I study more about mitochondria, I understand why. But so many people are, especially in the fitness industry, are anti-fasting. But now that I do it, it's massive, and I suggest everybody do it.
I think that's amazing. It's the nutritional strategy of the future. It's the intervention of the future.
Mm-hmm. So talking about mTOR and AMPK, because I know you're big at optimizing this muscle organ. Most people don't understand the intricate mechanisms. Can you give a little bit of a insight into just starting with those?
Yeah, well, I could give them the most important pieces that I talk to my patients about all the time.
Perfect.
So mTOR signaling is required for muscle protein synthesis.
Mm-hmm.
mTOR signaling, they also say, is, causes cancer and all of these things, right? And what the biggest trigger of mTOR stimulus is insulin. So the small feedings of carbohydrates through the day create this chronic stimulation of mTOR. And that is where you think about cancer, and that's where you think about all of these things, as opposed to having a bolus protein meal, which requires a minimum of 30 grams. You need 2.5 grams of leucine to stimulate this cascade, which this cascade is essentially a growth mechanism. And anything below that doesn't trigger it in terms of muscle protein synthesis. And then you've got, of course, the high carbohydrate feeding, which is negative in terms of chronic stimulation of mTOR synthesis, which they think is related to cancer. Although I haven't seen any, complete evidence of that.
To be honest, that's one of the reasons why I was so adamant about, less protein in my diet now and, even less regular feedings, because for 20 years, I was trying to be the biggest human on the planet. I know that I was constantly anabolic, mTOR, insulin, like constantly. So there's got to be some negative, my brain says there's got to be some negative effects to trying to accumulate that much tissue for 20 years. Any thoughts?
So I totally appreciate that. And I've thought a lot about it. And I don't think that is the issue in terms of negativity. I think that when you are then over 40, the chronic stimulation of mTOR becomes an issue. But I think when you're younger, it's okay. But back to what you're saying in terms of feeding and allowing the mTOR signaling to reset, I think is key. But there has been no evidence to link with cancer in terms of protein and cancer is not true.
Well, so what is it about that, over 40 demographic, in your opinion, that says, we should start maybe not constantly stimulating mTOR?
Because between 40 and 60, you're really at that window for things to go wrong, oncogenically, cancer-wise. So you really want to limit any kind of external triggers that could cause that to happen. So the multiple protein boluses, I don't know if that's true. When I think of mTOR and I think of cancer, I think multiple carbohydrates and excess calories being the problem.
Yeah. Because
that's actually, if you really think about it, the bigger driver of mTOR signaling.
I feel as though, it's massively to do with mitochondrial function. And as long as you're exercising, I tell these people all the time, your margin for error with your nutrition, it goes so much greater, because if your mitochondria are constantly turning over ATP and constantly functioning properly and have properly cellular synesis, it doesn't seem as though it's as likely that these cancerous things are going to happen.
And when you think about cancer, it's really, so that is true. Exercise is absolutely anti-inflammatory. It's the excess caloric load and it's the excess carbohydrate that's the problem. And I think that everyone demonizes protein, and they shouldn't, right? So it's very agenda driven. When it's kind of like the obvious, we're all missing the obvious. It's the excess calories and the excess sugars. When you think about insulin and cancer, it's not excess protein.
Right. Yeah, we shouldn't even go down the cancer road because that's just going to be that's just going to be controversial all around. So you said the other demographic that you're dealing with is people with metabolic impairment. So I'm guessing that's a slightly older population, or is that, when I think metabolic impairment, the first person that comes to mind is like female competitors. And I want to go down, not to pick on anybody, but I want to go down that road because like I've worked with so many female competitors that come to me because, ex-coach has screwed them up or somebody else has messed up their diet or they can't eat anything now because, they get fat or they have to do 2 hours of cardio. That's massive metabolic impairment. And I get tons of women that approach me on that topic. So I'd love for you to talk about that.
Absolutely. So we know with chronic dieting and overtraining, you get an elevation of reverse T3. So we know TSH stimulates the thyroid to generate T4. Mm-hmm. Then T4 is converted in the tissue to either T3 or reverse T3. Mm-hmm. So when I measure these women that have had metabolic derangement, usually their reverse T3 is through the roof, which means that the metabolically active aspect of their thyroid hormone is not working. And although I do come from a very functional medicine approach, I want to get these women out of distress quickly. I often put them on straight T3 to help liberate those binding receptors.
Do you think that's so long term, what's going to be the best strategy to start influencing the decrease in reverse T3?
You definitely have to pull back their training and start to overfeed them a little bit.
And that's so hard. Like it's exactly what I think, right? And trying to, the idea of reverse dieting for people, it's such a mind game for people to start saying, okay, we're going to train less and we're going to eat more. And it's progressive. Most people have a hard time. And I want to get into the cognitive aspect because obviously that's also right in your wheelhouse.
Yeah.
So talking about the cognitive effects, the cognitive intervention strategies with that.
So understanding their why. Why are you doing this? Ultimately finding something that means more to them than a physical external experience is really key, right? So what is the underlying driver of really kind of understanding how they got where they are, leveraging that perspective, and really changing their mind, help them facilitate kind of a mind shift or an aha moment. Those are the people that get the biggest success, right? Because we all have to have short-term sacrifice for long-term gain. It's just the way that it is.
Mm-hmm. Any interventions as far as analyzing female hormones? So like you said, you're my second female guest, and I want to give the female demographic a really, valuable tidbit nugget of information regarding hormone optimization and physique optimization specific to women, because I literally get so many women that are angry with me that I say, I always talk to men on my podcast because I'm like, I'm a man and I don't want to I don't want to claim to be the authority for women. You're certainly an authority for men and women. So giving the female demographic some insights as to how they can optimize thyroid, how they can optimize, there's so many levels, right? Progesterone and estrogen. Absolutely. And what should they be looking at?
So it's really about you can't fix what you don't test. So it's kind of like, well, how much do I weigh? Well, I don't really know. How much are you eating? Well, you don't really know because we're not tracking it. So the first and most important thing that all your women listeners can do is get good functional testing. Mm-hmm. So for my women with any kind of endocrine issue, we do 28-day saliva tests.
Oh, wow.
Right? So you don't just measure a snapshot in time. If you're going to do a blood test, it should be the week before their period, but a lot of these women aren't menstruating.
Yep.
So you really want to take a look at what their hormones are doing throughout a 28-day cycle. I have one competitive CrossFit female athlete, and we've really worked hard on getting her cycle back. And, we did it through testing. And then, of course, you want to measure your urine iodine. Another great test is a organic acid test. Mm-hmm. And that, I'm sure you're absolutely. Yep. So you kind of look at the whole picture. You look at all their thyroid function, you look at all their hormones, and then you kind of assess where they're at and where they're comfortable.
28-day cortisol test, is that once a day or are you doing that multiple times?
Hormone test.
Oh, okay. So explain that to me. So I thought you said it's a saliva test, right? You said?
It's a saliva test, and it tests estrogen, progesterone.
Really?
Yeah, all the estrogens, all the progesterones, and what they do through through a woman's 28 days.
And how accurate is a saliva test? I'm not familiar.
Yeah. So a lot of the traditional MDs really like blood tests.
Yeah.
but the percent accuracy, I can't tell you. We do know that it is pretty accurate, and institutions like A4M really focus on saliva testing.
Oh, fascinating. I had no idea that it would be. I knew cortisol was very relevant in saliva, but I didn't realize they could test for progesterone and estrogen.
So you can, and especially I do a lot of hormone replacement.
Mm-hmm.
And if you do hormone replacement that is topical, it's much better to do a saliva test unless they're injecting themselves with something, then you would do a blood test.
Interesting. Good to know. So you're saying you're doing hormone intervention. Where does it start for most people? What is the most common one you see? Is it going to be, you're giving people estrogen, are you getting progesterone?
The most common thing I see is estrogen dominance.
Okay.
So their estrogen is just through the roof and they're not making progesterone. So that's a big thing.
Okay, so most competitors go to male coaches. Not that we have to talk about competitors, but most of them will go to male coaches, and the coach will say, "Well, go take Novadex, go take an Anastrozole."
Right.
Can you talk about that?
Yeah, so that's a tricky topic because I'm not sure it's necessary.
I agree. That's why I want you to talk about it.
So, from the very obviousness of why you are a woman, why would you want to do that, right?
But
so
if they're estrogen dominant, we need to do something about it. Give people some really valuable takeaways. A different strategy rather than having to go.
Yeah.
To
So, for example, DIM or calcium D Glucarate. There's other ways to kind of rid the body of estrogens, and you're talking about keeping the best athletes in the world, the people with the most longevity, have a balance. Even if that balance is extreme, they can still have a balance of lower estrogens and lower progesterones, right, for a short period of time while they're competing. It doesn't mean you have to be so drastic in shutting down a female hormonal system. You're going to be in for a world of hurt. If you're eating things like cruciferous vegetables, if you're even augmenting your progesterone, right, to balance out that estrogen dominance, you should be able to get lean. And as long as you're training and eating well, there's ways that you can do it to protect yourself.
Awesome.
So the first thing that I would do is I would not use, obviously, an Arimidex. I would use something like calcium D Glucarate or DIM, have them have cruciferous vegetables, have them doing infrared, having them have nighttime progesterone. Even low-dose naltrexone is an anti-inflammatory, helps regulate the hormonal system. So there are other things.
I love
it. And of course, without sounding crazy, then of course there's the whole visualization and really kind of programming what kind of athlete they want to be. How are they seeing the success of what they're doing?
That's not sounding crazy at all. That's the direction that I think the fitness industry needs to go and needs to start realizing the necessity of that. And I don't know how much you've paid attention to the conversations I've been having on the podcast, but for growing up, we're all attached to the external outcome, right? We're all attached to the external stimulus, the external, faster, jump higher, whatever it is. But when it comes to physique enhancement and longevity, it's all about the internal response to the external stimulus. So I really believe that, the visualizations, the meditations, all those things are absolutely necessary interventions if you're trying to create this internal environment that mitigates stress, that allows your body to actually do what you want it to do. It's massive, and people just are blind to it.
Absolutely. And it's key. And I think that you're right on that cutting edge. I think you're right. And I think that you're having insights, and if through you talking about it in your community, really raising awareness of that, that's really going to push the whole bodybuilding, that whole community to the next level.
It's literally spreading the word and collaborating with people like yourself who are also thinking on that level and just tying all the missing pieces together, right? Like you seem, like I said, you're looking at every aspect and creating this awesome internal cascade to optimize longevity, optimize muscle function, hormone function. And you're doing exactly what everyone needs to be doing, and people need to be listening to you. Walking into the conversation that you brought up about infrared saunas, I want to talk about that and how comfortable you feel. But talking about environmental strategies that people can start implementing to make the most of their muscles, their hormones, their longevity. So, not just dietary, not just training, but are there other to use the catchphrase biohacks that...
So I use, that's a great question. All of my patients use heat therapy. I stick them in a hot sauna.
Do you know the temperature?
I know they're safe. Depends. It's either, if they're doing conventional sauna, it's at least 176 or so. And then if they're doing infrared, I'm not sure I think that's like 155, but it's really about kind of the waves and that internal kind of ambient heat. What I utilize with that is I give them high dose niacin for lipolysis and flushing.
What's high dose?
At least 500, 500 over 1,000. I push them up. Of course, they can have hypertension or blood sugar issues, and it really just opens up everything.
It sucks. I do it all the time. I'm used to it now, but when I used to, when I started, it's terrible. You're so uncomfortable. You're sitting there itchy and burning in the sauna.
Yeah.
It's a terrible thing, but it's so effective.
What dose do you use?
I was up to 3 grams, but I titrated. I started at 500 and I went to 3 grams.
And so, I mean, that's amazing. I always use heat therapy. And then afterwards, I give them some chlorella or clay. I give them some kind of binder.
Beautiful.
Are
you doing anything pre-sauna to help their body start to flush toxins? Or is it just like, hey, get in there and sweat it out with the niacin?
Sometimes I give them alpha ketoglutarate. Give them alpha ketoglutarate and niacin. But niacin is really the big one.
Do you have all these therapies in your clinic?
I do. We don't have a sauna. We don't have a sauna.
Cool. Any thoughts on, this is just coming to mind. So my brain, and yours is this way too, is, the idea of getting away from the treatment of illness and disease and bringing people back to health optimization. Any focus or opinion on IV vitamin therapy? Do you use any of that?
We do. We have a whole, in our center, we have about 4,000 square feet, and we have a whole IV room. There's a lot of good evidence for high dose vitamin C therapy for anti-cancer, inflammation. We use it all the time.
How high?
10 to 75 grams. I mean, we really go for it. We have mold detoxification, mold detoxification bags. We have everything.
I love that. So I'm the guy doing the 75 grams of vitamin C. I do it about once a month.
Okay.
I've been doing it for years, and I really feel as though it works. I'm going to knock on wood. I haven't been sick in 5 years, but and I feel awesome. And I don't recommend most people do 75 grams. I've obviously worked up to that. Yeah. Talk about the mold protocol, because most people aren't even aware that mold exists. And I live in Florida, and mold is everywhere. And what concerns should people be having around mold?
So mold is a huge problem. I'm seeing it in my clinic. I actually was exposed to it. I got really sick. It's the new epidemic. Mold is definitely, they've talked about Lyme, they've talked about all this stuff. Mold is the new epidemic. I'm seeing people that, for example, can't lose weight, totally fatigued. They're eating perfectly. They're training well. They feel horrible. They're getting joint pains. They don't know why. They just are completely tanked. And after a while, I'm seeing these people thinking like, this is just it's not right. I have them. There's a company called Real Time Labs that does mold testing in the blood. And then I'm thinking of one girl in particular. She is what you would absolutely think about as health. Trim, lean, eating everything perfectly. Still not getting better. Been to 4 functional medicine doctors. I had her home inspected. They said it was one of the worst homes of mold that they've ever seen.
Terrible.
I mean, just people they get really sick, and actually it creates a systemic inflammatory response. So they go to the doctor, everything's fine, but the GI system is a complete mess. Mold is definitely an issue.
So is that what's happening? Is it attacking the GI? Is it attacking mitochondria? From your opinion, what is it attacking, and what's the first line of intervention?
Well, it's attacking every system. I see tons of Hashimoto's patients that are actually underlying mold. The interventions, you have to remediate. You have to get an air filter. You have to move. I would usually put them through detoxification, saunas, and then IV therapy. So it has vitamin C, sodium bicarb, taurine, B vitamins, trace minerals. You have to upregulate the body's detoxification process. And then, of course, you've got cholestyramine and then these binding agents.
You've had some pretty successful interventions with people with removing mold?
Yep.
Good. Yeah, because I know that's a huge thing. I mean, we had mold in my house one time here in Florida, and literally I was like, all right, tear the whole thing out, we're moving, or are you taking this whole room out? It's legitimately like a scary, scary thing, especially if we've got little kids. So a massive concern.
Yeah.
All right. So now I'm going to pry into your life. How do you train? My question is always, how do you work hard?
So I work hard. I try to work as hard as I can every day.
Mm-hmm.
And it's been really interesting. So I was a fitness figure competitor
Mm-hmm.
for a really long time.
Mm-hmm.
And then I started doing CrossFit. And then I moved from CrossFit to Seal Fit. I don't know if you've heard of Mark
Yeah,
Divine.
sure. I did Mark very well.
Okay, Mark's amazing. He's a mentor of mine.
Yeah.
And I was training for Kokoro, and I avulsed my hamstring and my hip. So it has been a 80% avulsed right hamstring. So it's been about a 2-year rehab process. You asked me how I work hard. I've had to really cut it back, and I've done PRP, multiple rounds of stem cell, and I'm at the last stem cell. This will be number 4.
And it's still bad.
I have one more to go,
Oh, wow.
and I should be totally healed.
Good.
So in terms of working hard, it's really, for me, it's about working smart.
Mm-hmm.
So I do 3 Metcons a week, very short, high intensity. And then in terms of lifting, it's all about movement for me right now.
So tell me about your Metcon training.
Rowing, right? So it's 500-meter rows under 2 minutes, followed in between.
That was my question. What's your time 500 meters? I'm going to get competitive with you now.
Or the ski erg.
Okay.
So I do multiple rounds of that,
Mm-hmm. Yeah, I'm doing this. I'm
and
doing the
that's
same.
it. So it's so fun, but I have to be so much smarter now in terms of healing.
Okay, awesome. And nutritionally, you talked about doing some fasting from time to time, nighttime routines that people, obviously we know sleep is a massive component, and I'm sure you're a big proponent of optimized sleep. What should people be doing to optimize sleep to improve muscle function and longevity?
Well, in terms of sleep, having some great magnesium, right? So you have magnesium before you go to bed, really high doses, magnesium malate, magnesium glycinate, or magnesium threonate, which crosses the blood-brain barrier. Those are the external things that you can take. There's also the internal work, which is kind of recapitulation, reviewing your day, writing it down, identifying the things that really went well and the things that didn't go so well, and reformulating your day for the next day.
I love that you bring this stuff up. And to be honest, you're the most well-rounded practitioner that I've talked to in the last 5 years. So congratulations. Honestly, you're doing awesome, and I love what you're doing. I'm going to send everybody your way. Anything you want to tell people about, one last final thought on what they should be thinking about to live their greatest life? Obviously, we've talked about everything from hormone optimization to muscle optimization to training and sleep and meditation. What other one thing you do that you believe creates your greatness?
I always review every day my why I'm doing what I'm doing.
Mm-hmm.
And every action I take, that has to be able to fit into that why. Why am I calling this person? Why am I giving this recommendation? Why am I reading this? Why am I spending time doing this? It has to relate back to my greater purpose.
Which is?
And that's really kind of to educate humanity and help them live well. Right? To be a sheepdog. There's so much false information. How can I help people really take what they need so they can be the best version of themselves? Because ultimately we're just a vessel. Mm-hmm. Right? So how do they care for their vessel so they can have their highest purpose be expressed?
Love it. We're talking the same language every day. This is fantastic. I'm so grateful to have connected with you, Gabrielle. Where can people reach you?
They can find me on Instagram at Dr. Gabrielle Lyon or my website, and that's drgabriellelyon.com. I'm on Facebook. I'm just working on that. I've been kind of out of social media for a long time, but there's no other way.
And what does 2018 have in store for you?
A lot of teaching. So right now I'm going to be doing a lot of lecturing and teaching. Mm-hmm. And I really need to get my book finished.
Me too. Are you traveling around teaching for yourself, or are you teaching for other organizations?
In February, I am teaching for Charles Poliquin on muscle-centric medicine. So you guys should all come to that.
Where's that?
That would be amazing. That is in Phoenix. And that's February 4th. Hmm? Then I am teaching for I'm going to be on a panel of the National Spine Conference, and that's the end of February. So those are the 2 things that I've got planned right now, and then a few other things in the works.
How far along is your book?
Very well outlined. Very well outlined, and the introduction is done.
All right, I'm going to hold your feet to the fire to get that out in the first half of 2018.
Yeah.
Because I'm doing the same. So
how far along is your book?
About the same as you. I've got 2 full outlines, chapter outlines, table of contents kind of thing. And one is really extensive and it's long, so that one took me a long time. But the other one, I'm going to get done first. But that's the problem, is I always have, you do the same as me. You have one idea, you're like, oh, I really want to do this. And the next week you're like, I need to do this too, because they need to go hand in hand. So it ends up being 2. But my objective is to do 2 in 2018.
Amazing.
Yeah. We're talking the same. Yeah, I know, you better. And I'm going to be the first one to be promoting your book. So get it out there so we can help you promote it. It's been so great to connect, and I'm so grateful for what you're doing. So please keep it up, and let's definitely keep in touch.
Awesome. Thanks so much.
Thanks, Gabrielle. Hey, I hope you enjoyed that podcast. Thank you very much for listening. Head on over to iTunes right now and leave me a review. Let me know if you loved it. Let me know if you absolutely hated it. Either way, I need to know so I can improve my job and bring you guys the best information with respect to muscle building, health optimization, and building a better person, building a better man. So thank you very much to our sponsors, which make this stuff possible. I'd love for you guys to each head over and check out atplab.com, ATP Labs or ATP Lab, either one works. ATP is a company I've recently aligned with because they have world-class manufacturing, and everything they do is third-party tested and proven to be what it is inside the bottle that it says it is on the label. And you guys know that's massive. And not only that, we're getting the best quality ingredients from anywhere in the world that provides them. Thank you also to Prime Fitness USA, the best equipment for someone looking to build muscle and make the most of their time. I chose to reach out to Prime personally. They never reached out to me. I reached out to them because I knew what they had, and I really believed in their product, and I brought every one of their pieces into my gym, and we still use them every day because, we're all about mindful attention to detail. We are muscle intelligence. We are the ones teaching the best people in the world, the smartest people in the world, how to build muscle in the least amount of time. Another shout out to Gasp and Better Bodies for always taking great care of myself and my trainers and my staff. If you guys want to get a discount for Gasp Better Bodies, head over to benpakulski.com/podcasts and check out the show notes from this show and all of the other shows, and you can find transcripts there as well. So have a wonderful day. Upgrade your life, stay focused, and live a life of greatness.
Join us on benpakulski.com to learn the cutting-edge techniques to take control of your body, your brain, and create your greatest life.